What's going on, everyone? Happy Friday once again to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, February 2nd, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and all the other viruses in between. So if you want to learn how you can help keep yourself safe or be in the know on what viruses are going around, by all means, subscribe to my channel down below. And if you like this video at the end, give it a thumbs up and share it with anyone you know. All right, starting off today, Japan. We've talked about Japan quite a bit lately. Well, Japan is having an alarming surge in COVID-19 cases. 10 weeks straight increase. Half of them are aged 14 and under. This is not good whatsoever. The cases just continue to be high in Japan, and they have been seeing constantly high infections for at least 10 weeks now, and this is expected to continue for several more weeks. More news out of Japan. Tokyo Hospital is now on alert for COVID-19 resurgence, as they say the number of infections has gone way up, and half of its beds allocated for COVID-19 patients have now been filled and occupied with people who are sick with COVID. This just continues to get worse over in Japan, so we really have to pay attention. And anytime a country is going up on its own while the rest of the world's not, you have to start wondering, okay, we need to pay attention. Could a new variant pop? Could something happen? It's something you have to think about in the back of your mind. But you should always be most concerned with what's happening in your local community, because after all, just because it's surging in Japan doesn't mean that's where your case of COVID is going to come from. If something's going on in your community and you let your guard down, that's when you will end up testing positive, because you lost focus of what's going on in your local community. All right, taking a look now. Study finds Oklahoma leads the nation in long COVID. We've heard about this before. This is just another study that is confirming that Oklahoma is doing really bad with long COVID. According to the study, 34% of adults in Oklahoma are suffering from long COVID. Dean of OU's, Oklahoma University's Hudson College of Public Health, says it's due to multiple things, but one reason stands above all others. Patients who are not vaccinated are at a greater risk of getting COVID-19 long-term symptoms. And let's face it, Oklahoma is one of the low vaccinated states. They're very low. I haven't actually seen what their vaccination level is lately, but I can tell you, yeah, Oklahoma being the red state it is, they don't like to take their vaccine. All right, moving on. Norovirus is to blame for increased reports of illness in Wyoming. This according to the Wyoming Department of Health. Apparently they have been having increasing amounts of illness up in Wyoming, and they're putting the blame on norovirus. Alrighty, in this next segment, when I was a kid, we get snow here in Philadelphia. It snows. We always look to see if there were school closings for snow days. Well, I got school closings for you, but they're not for snow days. They're for illnesses. All right, starting off here with a charter school. This is up in northern Michigan. The Ojibwe Charter School in Brimley, once again Michigan, will be closed for the rest of the week because, well, they got too many people that are calling out sick. Staff are calling out sick. It's just bad. It says there are a large number of staff illnesses, and when you don't have enough staff, you can't teach the kids. Moving on, it doesn't stop there either. There is also school closings in El Dorado, Texas. The Schleicher County Independent School District is the next in a line of West Texas school districts to cancel classes and close campuses because of excessive illnesses among staff and students. And remember, if you've been following my updates, you can go back to some previous updates. Might have been earlier in the week, might have been late last week, I don't know. We've touched on this multiple times now. Have we seen outbreaks that are occurring in western Texas? This now makes, I think, at least 8 or 9 schools. And both of these stories do date back to yesterday, but you get the idea. There are still outbreaks ongoing in schools, and this is just a couple of them. These are only the ones that I have found make the news. I am sure there are others out there that we do not even know about or do not even make the news. Alrighty, taking a look at this now, we want to take a look at the air quality values in the United States because air quality impacts our health as well. And given I have asthma and a lot of you have asthma, maybe COPD or different things, it's very important that we track what's going on with our air quality. And you can see, looking across the United States, not terrible, but you do have these yellow sites and even some orange sites that are popping up in the Dakotas. There's some dense fog up in those areas. You do have fog advisories. And sometimes when there's dense fog, the air quality can also go a little bit more stale, poor. And that's the case of what's happening today. You also see some moderate air quality values along the I-95 corridor in the east, but then you see some reds popping up down in the Carolinas, along the coast, and Georgia coast, and portions of northern Florida. Not certain what that's all about. Not good to see. And then portions of California, some oranges, a few reds, and a couple oranges up in Washington and Idaho as well. If you want to learn more about climate and weather, I do have another channel where I just do that. It's called Climate Data Report. We just did today's report today, which we talked about, you know who, Punxsutawney Phil, and he called for an early spring. Well, I give the forecast for the rest of the United States and then talk about if that's actually going to happen. Spoiler alert. It's been a pretty warm winter so far. Think you know the answer. Alright, taking a look at the latest from BioBot, and you can see BioBot for wastewater. It's down in much of the country, but the drop, it's slowing down. And in fact, in the West Coast region, it's actually starting to rise for wastewater again. Yeah, not something that we're proud of seeing. Walgreens this week, 27.2% positivity rate this week. That's down slightly, but hey, testing was up and some states did go up. Alright, we have a whole bunch of things to look at from the CDC. This is the National Wastewater Activity, and you can see there's still a lot of places, a lot of states reporting very high wastewater levels. Texas, Alabama, Georgia, North Carolina, Tennessee is still very high. Vermont's still very high. You get the picture here. Not everywhere has really dropped. And these ones that are still very high, well, heck, they didn't drop at all because they're still at the highest level on the map. California, even you are coming in very high. Some places do come in low. Oregon's one of them. Nebraska's another. And then some states like Arkansas, which says minimal, or Louisiana, don't even update at all. So we have multiple states that didn't update, but minimal in Arkansas and minimal in Wyoming, which minimal is actually the lowest category. That's good for you guys. All right, moving on here. Here's the CDC site. Just going to briefly look at this. We're going to do wastewater bonanza on Sunday. We always do a full video on wastewater on Sundays. Take a look here. Orange and red sites. I'm actually not happy about this. 60 to 70% is orange. There's still 429 sites. And then 80 to 100%, which is red, both being very high levels of COVID. It didn't drop by much. 314. Red dropped by 12%. Orange dropped by 14%. I was hoping that would drop a little more. It didn't. And it just goes to show you that there is this resurgence, which is, where places were dropping and then went back up again in some of these areas. And that could be the reason why this drop is not going as fast as it should. There is a slight bit of good news, though. 0 to 19% COVID detected. That's now up to 37. That increased by 68%. Continuing on here. Deaths in the past week. This is not good. There are still deaths occurring. They're still occurring at far too high levels. They're actually not even dropping yet in the United States. They are rising in Arizona, Oklahoma, Tennessee, Mississippi, South Carolina, North Carolina, Maryland, Pennsylvania, New Jersey, New York, Connecticut, New Hampshire, Puerto Rico, and there may even be some other states mixed in between that are seeing slight increases of deaths as well. So yes, deaths at this time, they haven't really fully dropped yet. They are still either stable or rising in the United States from the winter surge. Yeah, not a good thing. We hope to see them drop below 2,000 a week fairly soon, or else we got a real problem on our hands. All right, taking a look at the number of people in the hospital. This did drop. This is some good news. Always got to get some good news in there, and we do here. Number of people in the hospital admitted in the past week, 22,636. That's down by 10.9%. Then we come over to this, and this is kind of interesting. It's a little little bit of a surprise to me. While we've been talking about states that are starting to rise again, we're not really seeing it here on epidemic status. However, suddenly South Carolina is at the highest shade, which is growing. So, yeah, things are not going good for you in South Carolina. And then we do see a lot of states at this time are stable or uncertain. And that could be some states that have some wastewater sites rising while others are dropping. Then you do see there's quite a few that are declining or likely declining. Then we come down to influenza. And I'm going to say it, this is not good. Influenza is actually rising again in several places in the south and in the northeast as well. You have growing status now in Florida, Texas, Oklahoma. New York State's now back to growing status. Then you have likely growing in places like North Carolina, South Carolina, Kentucky, Arkansas, even up in Massachusetts. And then everything in between, you got a lot of states that are stable. Then you do have some states that are likely declining, such as Maine, New Jersey, Arizona, and so on. Then you have declining status in California, Tennessee, Alabama, Washington, Nevada, New Hampshire. So that is good to see, but it's not good to see that we still have some states that are likely growing, or even in some cases, growing once again. Never a good thing to see a resurgence. And speaking of that, I decided let's just shift the flu update to here instead of the end of the video. And you can see we do not have any purple on the map this week. However, we do have some maroon areas still, and do we? No, we do not have any maroon areas now. What we do have is these brighter red shade colors in New York, South Carolina, Georgia, and in New Mexico. And then we have the other shade of high, which is in Ohio, Tennessee, Arkansas, Louisiana, Washington, D.C., Texas, North Dakota, and then we also have it in Colorado and Wyoming. So there's still quite a few high flu areas, but what you do see here is New York is at minimal. That's not making much sense to me. So New York's at minimal on this map, but you come back to here and it says epidemic status. Oh no, it's growing. Well, if it's growing as much as it says it is, how can it be minimal? Sometimes it's a tongue twister with the CDC sometimes. That doesn't always make sense, and in this case, to me, just does not make sense. If you can make any sense of it, let me know down below. Alright, talking about variants now. JN.1 is now 93.1% on the national level. Yes, it has really gone up. It is clearing the board. If you want to learn more about the majority of the regions in the United States, not all of them, because not all of them update, I did do another video about that this morning. I'll put a link to that down below if I can, and you will be able to go check that out. Alright, Philadelphia yesterday for EMS calls, 734. I'm happy with that. It's still low. It's not increasing again. That is good to see. Let's see what's going on in Montgomery County, Pennsylvania. Nope, didn't think we would be able to. I was hoping I could show you Montgomery County CAD, but for the last several hours, it has not been working for some reason. Chester County, Pennsylvania. We just have stroke, hypertension, back pain, and a sick person. Just 4 calls right now. That's not busy at all. That's, matter of fact, for 5:30 on a Friday, that's actually really good. That's a good thing to see. So calls are still, volume is still dropping in this area. But we did see, back around the holidays, the cats, they went absolutely insane. That was how I knew for a fact there are no way that these numbers being reported in hospitals were correct. We knew it was an undercount because they're not doing enough testing. New Jersey, things continue to improve. 891 hospitalizations. Yes, I get it. 4 hospitals did not report. One of them could be a big hospital. It's possible. 66 out of 70 hospitals. But hey, 891. And the real number's probably at 950 or less would be my guess at this point. So it's dropping. There's no doubt about it. It's dropping. On ventilator, 44. In the ICU, 114. And let's see, 160 people got discharged and were able to go home for the weekend in the state of New Jersey. Taking a look at New York State, 3,192 people test positive. Doesn't include them at-home tests. Of course, it never does. And taking a look at this, New York State hospitalizations, 1,981. They have dropped below 2,000 hospitalizations in New York State, and I suspect next week that's going to continue below 1,900, maybe even below 1,800 next week. That is some good news out of New York State. speaking of good news, we have some more good news for you. Well, this is not good news. Arkansas did not update. I wasn't going to show this, but here we are. Most recent update, 1,683 cases and 152 hospitalizations and just one COVID death. But this data goes back multiple weeks, so it is very outdated data. All right, taking a look at that other bit of good news now. Here we go. California, COVID-19 test. They're down, but everything else is dropping as well. They still had 2,549 emissions. Man, that's a lot. That's a huge number of the weekly emissions in the United States right there in California. But again, that is down by 16.7%. Deaths are down ever so slightly. And look at influenza. You can see it on all charts here. Influenza at this time in California is dropping. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll have another pandemic update again tomorrow. I'm sure we'll have more news for you, and we'll find out some more things that this darn COVID virus can do. If you enjoyed this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you got anything to say, by all means say it. If you want to share this, go at it. Share this video. We're trying to grow up the channel to 10,000 subscribers this year because I really think it is important that we get more people to see this channel because everyone thinks, well, the news is not talking about it. It's not a big deal. No, 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 no. We need this. We need this channel. We need this dedicated time slot that I do every day to provide an update on what's going on right now, the real deal of what's going on, because let's face it, there is no one other than News Nation. Chris Como on News Nation is the only one I'm seeing take initiative to actually report this in the media. Alrighty, folks, I'll see you again tomorrow. Have a great night. Stay safe. If you don't catch me this weekend, have a fantastic weekend, and thanks for watching.